Hi, my name is Kristen. I'm a student physical therapist. Is it okay if I work with you today? Okay, so we're going to be testing cranial nerve 1, which is your sense of smell. So we're going to have you close your eyes and occlude one of your nostrils and tell me what you're smelling. So go ahead and close your eyes. Okay, cover either nostril. Tell me what that smells like. Coffee. Okay, other one. Perfect. So an abnormal response to this is she's not able to properly identify the objects. Okay, so next we're going to be testing her optic nerve. We're going to start with her lateral visual fields. I'm going to just hold out both fingers to the side of you. Can you still see my fingers? Yes. How about now? Yes. No. Okay, all right. Let me know when you start to see them. No. Okay, perfect. Now, same thing. Can you see either one of my fingers? I can see the bottom one. How about now? Okay, let me know when you both see them. No. Okay, perfect. So next I'm going to be testing her medial vision field. So go ahead and cover either eye. Okay. Can you see my finger? No. Okay, let me know when you can see it. No. Okay, same thing. We're going to do the other one. Can you see my finger? No. Okay, let me know when you can. No. Okay, perfect. Now I'm going to have you look right at my nose. Okay, I'm going to be wiggling my fingers and let me just point to which one you can see. Okay. Same thing, looking at my nose. Perfect. Okay, so now we're going to go over to the Snellen chart and we're going to test for her visual acuity. We're going to go ahead and walk over here. Okay, I'm going to have her sit down in this chair and go ahead and cover either eye for me. And go ahead and read the number you can see the lowest. FDPLTCEO. Perfect. Go ahead and cover that other eye and read it backwards for me, please. OECTLEDF. Perfect. All right. Okay, so we'll be moving on now. We're going to be testing cranial nerves 3, 4, and 6. Prior to starting these examinations, I'm going to be looking for strabismus, ptosis, as well as equal pupil size in the patient's eye. Okay. All right, everything looks great. So I'm going to start off by testing specifically cranial nerve 3 with the pupillary light reflex. I'm going to be looking at direct as well as consensual constriction when the light is shined into the patient's eye. So you can go ahead and cover either eye for me. All right, I'm just going to be shining a light in your eye. It's going to be a bit bright. Okay, good. You can go ahead and cover that side, same eye. Beautiful. Okay, other side for me. Same thing. Good, go ahead and cover. Now I'm going to look at the other eye. Perfect. All right. So this next test I'm going to be doing is considered to be called the H test. I'm going to be testing cranial nerves 3, 4, and 6 all at the same time. I'm just looking for a smooth pursuit as she's following the tip of my pen. So I'm going to have you look right here at the tip of my pen, just following it just with your eyes. Okay, we're going to do that one more time. Good, now keeping an eye on that tip of the pen as I come in. Okay, so that last test, I was going closer into her nose. I was testing, that is the Convergence test, and I was just looking for an even response of the eyes to be coming in simultaneously. So the last exam here, I'm going to be testing her saccades also for a smooth pursuit, doing a quick motion and calling the colors out. Okay, I'm also going to be noting for any nystagmus. Okay, so I have 2 colors right here. I'm gonna call it out, and you're just going to look quickly with your eyes for me. Okay? Okay. Blue, great. Blue, great. Blue, great. Perfect. Okay, so now we'll be testing cranial nerve 5. I'm going to start off by doing the motor component. So I'll be testing her jaw strength as well as the symmetry of her muscles of mastification. So we're going to start off with the jaw jerk here. Go ahead and open your mouth for me. Just relax. You can go ahead and close your eyes. And I would expect the mouth to close a little bit here. Alrighty, go ahead and clench your teeth together. Perfect. And now open your mouth against my resistance. Good. And then close it. Perfect. Okay, so now I'm going to be testing the sensory components. Now we're going to be doing light touch first. I have this cotton ball here. Okay, I'm going to be placing on different parts of your face. But first, I'm gonna let you know what it feels like on your arm. Do you feel that? Okay, so I'm gonna put it on your face. Let me know yes if you feel it and as it feels the same as your arm, all right? Go ahead and close your eyes for me. Yes, 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 yes. Perfect. So now we're gonna be moving on to sharp and dull, also sensory. So I have a paper clip here. Promise, not gonna draw blood. I'll show you on my hand first. We're not going to be doing anything hard, okay? So I'll let you feel it on your arm first. Just indicate if that feels sharp or dull, okay? Sharp, good? Dull. Perfect, same thing. Go ahead and close your eyes for me and let me know if it's sharp or dull. Sharp, sharp, dull, dull, sharp, dull, dull, sharp, dull. Perfect. So an abnormal response would be an impaired sensation. Okay, so now we're going to be testing cranial nerve 7. I'm going to first test the motor component of it. So go ahead and smile for me. Frown. Can you put a bubble in your mouth? Raise your eyebrows for me. Close your eyes. Keep them nice and tight. Don't let me open. Okay, go ahead and relax. I'm testing the muscles of facial expression as well, making sure they're just symmetrical on both sides as well as working properly. So now we're going to go into the sensory component, which is testing the taste of your anterior 2/3 part of your tongue. So I have 2 different substances I'm going to place on your tongue and you're just going to identify what they are. So go ahead and close your eyes for me and stick out your tongue. Alrighty, let me know what this is. Salt, good. Sugar, okay. Salt, So an abnormal response of this would indicate impaired sensation. Okay, so now I'm going to be testing cranial nerves 10 and 12 together. So first off, go ahead and stick out your tongue for me. Open your mouth and say ah. Okay, so I was testing there to see if there's any deviation of her tongue, and that's 12. If it were to deviate, it would deviate towards the weak side. Another test for 10 is assessing the symmetry of swallowing. So I'm going to have you take a swallow of this water. Don't swallow it until I tell you to. Go ahead, swallow. Perfect. So all of 10 would be assessing if the palate rises when she says ah, or if any garbling or hoarseness. And also if the uvula were to deviate, it would deviate towards the strong side. Okay, so now we're going to be testing cranial nerve 11. I'm going to be assessing the strength of her sternocleidomastoid as well as the upper traps. I'm just going to be assessing that they're equal to either one each other on each side. Before we start, do you have any jaw problems? Okay, you can go ahead and just shrug your shoulders for me. All right, I'm going to push it down, don't let me. Perfect, go ahead and relax. Alrighty, if you can go ahead and look over to that side. Here's okay if I place my hand on your face. Okay, I'm going to try to push you, don't let me. Perfect, same thing, other side. Don't let me push you. Perfect. So the last cranial nerve we're going to be testing is cranial nerve 8, and here is a series of tests. So the first one we're going to be doing is called the Russell test. Okay, so I'm going to have my hands by your ears. I'm going to be rustling my fingers, and you're just going to point to which one you can hear. Okay? Perfect. So in this test, we're just testing her conductive hearing, whether she can hear it in the ears or if one is louder than the other. If she can't, it can indicate a possible conductive issue. Okay? So the next 2 tests I'm going to be doing, I'm going to be using the tuning fork. Okay, the first one I'm going to be doing is the Rhine test. This here is a tuning fork. It makes vibration when you hit it. Okay? So I'm going to be placing it next to your ear as well as behind your ear on the back of your skull. Okay? Next to your ear is 1, behind your skull is 2. You're just going to tell me which one sounds louder. All right? 1. Okay, good. Now we're going to do the other side. 1. Perfect. Okay, and the appropriate response for this exam would, 1, by the ears, be louder than the one placed behind the skull. And if that was not the case, it could indicate a possible conductive issue as well. So the next test I'm going to be testing is the Weber test. Okay, so same thing. I'm going to be making the tuning fork vibrate, I'm just going to place it on top of your skull, okay? So if it feels or sounds equal on both sides, just say equal, and if it doesn't, say no, and then I'll ask you a follow-up question, okay? It's equal. Equal? Perfect. Okay, and the appropriate response for this exam would be for it to be equal. If it was not to be equal, meaning it was louder on one side or the other, it could indicate a sensory neural issue. Okay? So the next test we're going to be doing is VOR, which is going to be testing the horizontal canals. Okay, so I'm going to have you go ahead and place your your thumbs in your ears and your fingers like that, and just tilt down slightly. Okay, you can go ahead and remove your hands. Okay, you're just going to look right at my nose as I move your head back and forth. Okay, any dizziness? No. Okay. So during this exam, I'm just assessing for any nystagmus, dizziness, double vision, or blurred vision, okay? The last exam we're going to be doing is called the Dick-Hallpike exam. Same thing, going to be assessing for that dizziness, blurred vision, nystagmus, or double vision, okay? So I'm going to first off raise the table up. So I'm going to be moving the patient's head towards the left and taking her back. So therefore, I will be testing the left posterior canal when I do this examination. Okay. Okay. I'm going to have you go ahead and just scoot back for me. Swivel your legs up. Right there. Scoot a little bit towards me. Perfect. I'm going to straighten your legs out. Okay. I'm going to have my hand here. You go ahead and grab it to my arm. In a second here, I'm going to lay you back. We're going to hold it for 30 seconds. Okay. Okay. Ready? Okay, try not to fixate on any points. Move your eyes around. Keep your eyes open. Okay, are you experiencing any symptoms? No. Okay, good. About halfway there, you're doing great. Keep on moving those eyes, good. Perfect. All right, and we're just going to stand right here to ensure our patient isn't experiencing any dizziness. How are you feeling? Good? Good? Okay, perfect. That concludes our testing.